Hello, this is Dr. Carlo Oger, emergency physician. In this video, we're going to talk about bacterial vaginosis. Bacterial vaginosis is a mild infection of the vagina caused by bacteria. It is experienced in 1 in every 3 women at some point in their life. Normally, there are a lot of good bacteria and some bad bacteria in the vagina. The good types help control the growth of the bad types. In women with bacterial vaginosis, that balance is upset. There are not enough good bacteria and too many bad bacteria. Bacterial vaginosis is usually a mild problem that may go away on its own in a few days, but it can lead to more serious problems, so it's a good idea to see your doctor and get treatment. Experts are not sure what causes the bacteria in the vagina to get out of balance, but certain things make it more likely to happen. Your risk of getting bacterial vaginosis is higher if you have more than one sex partner or a new sex partner, if you smoke or you douche. Bacterial vaginosis is not a sexually transmitted disease. The most common symptom is a smelly vaginal discharge. It may look grayish white or yellow. A sure sign of bacterial vaginosis is a fishy smell, which may be worse after sex. About half of women who have bacterial vaginosis do not notice any symptoms. Doctors diagnose bacterial vaginosis by asking about the symptoms, doing a pelvic exam, and taking a sample of the vaginal discharge. The sample can be tested to find out if you have bacterial vaginosis. What problems can bacterial vaginosis cause? Bacterial vaginosis usually does not cause other health problems, but it can lead to serious problems in some cases. If you have it when you're pregnant, it increases the risk of miscarriage, early preterm delivery, and uterine infection after pregnancy. If you have it when you have a pelvic procedure such as C-section, abortion, or hysterectomy, you're more likely to get a pelvic infection. If you have it and you're exposed to a sexually transmitted disease including HIV, you are more likely to catch that disease. Getting treated with antibiotics can help prevent these problems. How is BV treated? Doctors usually prescribe an antibiotic to treat bacterial vaginosis. The ones most commonly used are metronidazole or flagyl and clindamycin, also called Cleocin. They come as pills you swallow or as cream or capsules called ovules that you put inside of your vagina. If you are pregnant, you will need to take pills. Bacterial vaginosis usually clears in 2 to 3 days with antibiotics, but treatment goes on for 7 days. Do not stop using your medicine just because your symptoms are better. Make sure you take your full course of antibiotics. If you're treated with antibiotics, you must avoid all alcohol use, including over-the-counter medicines that contain alcohol such as NyQuil. If you are taking metronidazole or tindazole, mixing alcohol and metronidazole or alcohol and tinidazole can cause severe nausea and vomiting. This is called a disulfiram-like reaction. The oil in clindamycin cream and ovules can weaken latex. This means condoms and diaphragms may break, and you may not be protected from STDs or pregnancy. Antibiotics usually work well and have few side effects, but taking them can lead to a vaginal yeast infection. A yeast infection can cause itching, redness, and a lumpy white discharge. If you have these symptoms, you must talk to your doctor about it. It is important to follow up with your primary care doctor. Make sure the infection is completely resolved and that you have not developed any complications from its infection or its treatment. Also, you must review the culture results to make sure that there was no co-infection with other bacteria that can also cause vaginitis. You must go to the emergency department urgently if you have fever, chills, increasing pain or discharge, or otherwise deteriorating in your condition. For other videos like this one, please go to edxitvideo.com. But remember, these are educational videos and should never replace the advice from your medical provider.